Coming up on MedWatch today, hit after hit, the dangers of concussions, and one cheerleader's story of how she's hoping to educate others. How soon should you get your kids in to see an eye doctor? A pediatric ophthalmologist weighs in on how to make sure your children are off to a healthy start. And no need for open heart surgery, the new procedure that's bringing new hope to some heart patients. Hi there, and thanks for joining us. I'm Julie Musgrave. With the kids heading back to school, it also means the return of contact sports, and with that, the risk of injury, specifically head injuries. For one former cheerleader, her undiagnosed concussions nearly cost her her life.
It was a passion for me.
Kelsey Egason fell in love with cheerleading early on.
It was a freeing feeling to lift someone in the air and catch them. It's such an achievement.
She cheered competitively. Workouts were rigorous and the skills high-flying. But what she didn't know is that with every fall, her brain took a hit.
We fell. That's the way it was.
Kelsey says it wasn't long before she started noticing changes in her own behavior. Doctors blamed puberty, but physically, she says things just weren't right.
Headaches. Nausea was a big one. I would come home from practice and take long baths and just feel like I wanted to throw up.
With a brain injury, you don't see it, and oftentimes there's no external evidence of it.
Brenna Hughes works in the acute care speech pathology department at Community Regional and is considered an expert when it comes to concussion management.
It's a form of mild traumatic brain injury, and it goes missed, undiagnosed frequently.
She says concussions go well beyond the usual suspects like football. They can happen with any sport, from car accidents, even following fights. Because of that, she calls traumatic brain injury an epidemic for the Central Valley.
If we're putting kids in a high-risk environment to hit their head, we need to be prepared when they do.
Kelsey was not prepared. Instead, she went undiagnosed for 10 years.
It hurt emotionally, it hurt physically, it hurt mentally on so many different levels, but I didn't know it was because of a concussion. I took it personal.
To numb the pain, she turned to substance abuse, and when she still didn't feel better,
where I jumped attempting suicide.
That last resort is how she ended up at Community Regional.
And in walks Brenna.
Brenna, finally, would be the one who helped her find answers.
When I see a young adult or a child with a very high-risk behavior, I have red flags going up in my head.
It took 10 years, but Kelsey says finally she realized all those falls in the gym weren't as harmless as she thought.
I was diagnosed multiple undiagnosed concussions and traumatic brain injuries.
Kelsey estimates she's had about 100 concussions, but with the help of Brenna and the team at Community Regional, she's managing her diagnosis.
I feel so solid and I feel so proud because I have that missing factor.
She hopes her story can now help others not let a traumatic brain injury go that far.
Now that it's out there and we know about it, I'm hoping that it gives people the inspiration to advocate for themselves and feel confidence behind it.
If you suspect a concussion, here are some of the symptoms: headache, dizziness, nausea, vomiting, sensitivity to light, and irritability. But keep in mind, not every person experiences these. If you or your child has hit their head recently, the team at Community Regional says it's best to talk to your doctor and be proactive about concussion awareness. Kids, especially babies, may not be able to communicate a vision problem like you and I can, but it doesn't mean a problem can't be fixed. We sat down with Dr. Derek Holt for advice on how to get kids on the path to healthy eyesight as early as possible. Dr. Holt, thank you so much for joining us today.
Yeah, thanks for having me.
You are a pediatric ophthalmologist with a
focus with community. They refer their patients over to you. Where do you take those patients from there?
Well, we see patients of all ages, from the tiniest little babies all the way up to teenagers. And we perform a comprehensive assessment of what's going on with their vision. And depending on the age of the patient, the assessment is different. So kids that are very young are still developing their vision. And that's something that's really important for parents to understand. So we have to assess those kids differently than kids that are older. But we have all the facilities and equipment and everything that we need to assess kids of all ages.
What are some of the things that you're looking for when someone comes in?
Well, so we look at, for instance, in little ones, we look, are they meeting the milestones where they should be for vision for their age? We also will check to make sure that their eyes are properly aligned. That's a major problem that can happen, especially in younger children, that their eyes, either they don't move properly or they're not properly aligned, so that they're not able to use their two eyes together properly. But we'll also look at kind of what is their visual function from a very basic age. Do they respond to light when they're very young, up to different sorts of visual responses in babies and toddlers, all the way until when they can start to give us actually a verbal vision.
Are there things that parents should be doing or looking out for at home?
Well, I think that parents should be aware of the fact that kids can have serious problems with their vision, and not just assume that everything is going to happen and happen appropriately. If parents notice a problem with something that is obvious, like their eyes are misaligned, or kids seem to have a hard time finding things, or you try to point something out to them, they have a hard time finding it, or maybe they see that their kids are squinting a lot or something like that, then they should definitely have them come in to have an eye check. Another thing to be aware of is if there's any family history of any eye problems in childhood, then we want to see those kids too. And just in general, you know, if a parent had a problem that started when they were 10 years old, we should probably see them a couple years before that, just to look at everything and make sure everything looks okay.
Earlier is better.
Earlier is better. You know, another thing that's very important is to realize how important it is that they see their general pediatrician for their general well child checkups. The American Academy of Pediatrics has a well-structured kind of recommendation for when kids should undergo vision screening and how the screening should be done. And our pediatricians within our community network do a great job of doing those assessments. And then when kids come up with a problem on one of those screening tests, then they do a great job of getting those kids in so that we can do a comprehensive assessment and see if there is a problem there.
Good advice. Dr. Holt, we sure do appreciate it.
Thanks.
Coming up on MedWatch today, starting a new life where their family began. Why one couple chose to say I do at Terry's house across from Community Regional Medical Center. Plus, the organizer behind Clovis Community's busy OR schedule. We'll meet our healthcare hero who says her goal is to make sure you have a great experience.